So today's conversation is on the layered stigma and discrimination surrounding HIV. Thank you both for very graciously accepting my invitation, Hans and Dr. Janaka. Dr. Janaka Weragoda is consultant community physician with the National STD and AIDS Control Program for Sri Lanka. And of course, Hans Billimoria is director of the Grassrooted Trust, a wonderful organization doing work on preventing gender-based violence and also advocates for education reforms on sex and relationships in Sri Lanka. Welcome and thank you again both. Hans, let me start with you and ask a question that I think everyone knows the answer to, but is important to frame our conversation. What is HIV and how is it, or more importantly, how is it not transmitted?
I think the doctor would be better placed. But
I want your opinion first.
Okay, no, I'd say.
And then I'm going
I know. Yeah. So, human immunodeficiency virus. It's a virus that attacks the immune system. Now, generally, doctor, when I do my sessions, I talk about 5 body fluids. I talk about semen, I talk about vaginal fluid, I talk about anal mucus, I talk about blood and breast milk. Those are the 5 I talk about. And because the conversation is around those 5 body fluids, sometimes those conversations are difficult. So it's difficult sometimes to have that conversation because look at the body fluids we're talking about, is my feeling, right?
Absolutely. So if I was going to move to Dr. Janaka, please do add to that question in terms of what is the current situation globally and in Sri Lanka on HIV? How are we managing the virus?
Yeah, globally, Thanuja, it's around, at the moment, there are about 40 million people are living with HIV. Every year, around 1.5 million are detected newly. If we talk about Sri Lanka, annually, number of cases with detected HIV has gone up. Gone up.
Okay.
If you consider 2023, last year, we got about close to 700, 694. Before that, around 600. Before that, around 400. That means every year it has gone up. And if you consider last 3 years, 21, 22, 23, 1,700 newly detected cases are there.
Okay.
And out of that, male to female ratio 7:1, and almost 1/3 below 29 years of age, young crowd.
Okay. So if you look at testing and treatment in Sri Lanka, what would you?
Yeah, testing and treatment is freely available in Sri Lanka. That is one thing. Testing is available in private sector also, as well as government hospitals.
Doc, correct me if I'm wrong, but we had quite an aggressive target for no new infections. Global target was 2030. But because we have a test and treat campaign, right? So that's it's at the moment on.
Yes.
Do you think the increase in testing has anything to do with the increased numbers? Or are there other factors at play?
There are some other factors also, because if you consider last 2-3 years, number of testing has almost around 1 million. But number of cases detected has gone up 10 to 15% every year.
Testing and treatment, you mentioned the government sector, is that free?
Free, completely free of charge. Testing as well as free. And at the same time, we have maintained the confidentiality and the privacy of all these people.
It's one of the best systems in South Asia.
Okay.
Now, having worked in the region, Sri Lanka, I suppose, because we are small, no, doctor?
Yeah,
because
that's the one thing.
Because we are small, because our Ministry of Health is very good on other health indicators also. It's one of the best systems. So even today, for example, I was talking to doctor earlier, there is a website called knoforsure.lk.
Okay.
Now, if you go to that website, it's so user-friendly and it allows you to sort of navigate that space and get yourself to a testing.
Exactly.
The response is there.
Okay.
The free treatment is there. Talking about treatment, I think, is very important also, and what that means today. But unfortunately, I don't think that information, sir, is necessarily percolating down. So if you're saying up to 29 years old, that means fundamentally it shows that our education system has failed.
What is the awareness and education that people have on safe sex? If we talk about prevention first.
I'm also not happy with the education system about sexual education. It is too late. It has to be taught from grade 6 or not, at least, about sexuality, and the HIV they talk in grade 11. It's under
health and physical
education subject. Very nicely written book in grade 11, but it is catered only people who have opted the subject. But the thing is, some people in some schools, teachers are a little bit reluctant to talk on that, and they skip. I don't want to blame the school teachers, because system has to be strengthened. And these teachers also, we have to understand, these teachers also has grown in a culturally restricted environment. Think about 30, 40 years, but they were born about 30, 40 years back. But system has to be strengthened to make them empowered and to be monitored whether it is happening or not.
So, health and physical education has a lesson on HIV in grade 9. No, sir?
Yeah.
Yeah. So it starts in grade 7, then you have grade 8, and then you have grade 9. And in grade 9, they jam a very mediocre, opaque version on HIV on the children. And then by the grade 11, grade 10 and grade 11, which is optional, by grade 11, you have a very comprehensive lesson.
Right.
I think one of the best lessons probably in South Asia in terms of the treatment available, in terms of prevention strategies, except here's how it is said. Over the world, HIV prevention follows what we call an ABC methodology. Not the sir?
Yeah.
Right. So A is abstinence, B is be faithful to your partner, and C is condom use or correct and consistent use of condoms. Now, if you see the A in the grade 11 textbook, it's very clear where there is encouragement to not have sexual intercourse before marriage. Fine. Then the B is also very well represented in terms of being faithful to one partner. And then we get to the C. The C is not represented except that there is an oblique statement which says, assess your risks and take precautions. That is exactly what it says.
Okay, we're talking about healthcare, medical issue, where we have solutions for prevention, for treatment, for testing, which is a situation that can be absolutely managed. We'll get to that. I do want to talk about that a little bit more. But then we're also talking about how much do people know of what they can do to be safe.
Yes.
So,
yes.
Essentially, at the core, in terms of awareness and education, this is a problem about our inability or refusal to openly talk about sex.
Well, the data shows, sir, if the young under 29s are now an increasing number,
yeah,
then it shows a failure in us being able to communicate. Every conference we go to, what has been the solution, sir? Comprehensive sexuality education.